Hello everybody, hello everyone, and welcome back again to my channel. This is a review of musculoskeletal system, a brief review of anatomy and physiology by yours truly. I'm Juanito A. Mandia. I am a registered physical therapist and a registered nurse as well. Without further ado, let's start the review. The musculoskeletal system composed of the muscles of our body and the bones. Now, the functions of the bones are it supports our body primarily. We're able to stand because of the bones, and it protects the internal organs, or specifically on the trunk that holds and protects the heart, the lungs, the liver, the GIT tract, and every internal organs that we're able to have in our body is protected by the bones. And also for locomotion or movement, mobility, that's for the functions of our bones through the help of your skeletal muscle by their contraction. It also serves us for attachment of other structures, including the bone itself, the joints, and the ligaments. Another functions of your bones is formation of the blood cell, which includes your erythrocytes or your red blood cells, and as well through your bone marrow, and as well as your plasma, and as well as some are platelets as well. It also regulates our calcium and phosphate concentrations. That's why calcium are deposited on our bone to make it more harder. It should not be deposited on the blood, and that would increase hypercalcemia. Okay, remember that. So that's the functions of our bones. Next, we will have your skeleton. Okay, now the skeleton divides into two, with your axial skeleton and then your appendicular skeleton. The axial skeleton includes your cranium, the vertebrae. Now the vertebrae, it has 7 cervical. We have 12 thoracic, and we have 5 lumbar, 1 sacrum, and then the tailbone called the coccyx is 1, wherein it houses the spinal nerves. Okay, it protects wherein they exit and protects the spinal nerves as well. That's for the vertebrae. And we have ribs, which is 12 pair of the ribs. So we have the true and false ribs and the floating ribs. Now, the true ribs attached to your sternum. We also have the floating ribs, which attach to the like the cartilages. That's why they call the floating ribs, like the 9, 10, 11, 12. So that's your axial. Now the appendicular are mostly the heaviest and the longest bones, includes your limbs. So you have your humerus, your radius and the ulna, and then your metacarpals and phalanges. Now the longest bone in the body is your femur, which is commonly fractured with an elderly person. So we'll be watchful for that. The shoulder. So these are the shoulder, like your shoulder blades, your clavicle, and then your sternum. Commonly fractured are the clavicle on a runner or on a football player. So there are shoulder, those are athletes like for volleyball, basketball, so those they commonly be dislocated. Then we also have the hips. So hips are important for pregnancy. They need to be lax. So they need to be lax so the baby will come out. So that's for your axial and appendicular. We have 26 bones. 206 bones. What if you only have 26 bones in the body? Okay, now we have 206 bones in our body, the whole body. So overall, that's this. And divided into long bones. So we already got example of long bones are your femur, tibia, and then your fibula, and then also your humerus, your radius, and ulna. So those are example of the long bones. Short bones, like your carpals, example of that, and then your metatarsals and your metatarsals, short bones. Irregular bones, example of your irregular bones are your scapula, the shoulder blades, so that's our example, and then your tarsal bones. And flat bones, example of the flat bones are your hips or the pelvis, example of that. So that is your bone, 206 bones overall. Now, functions of the joints. The joints, it allow movements between bones. So this is an example of your joint. Functions of your joints includes allowing movement between bones, so in contact, so that there are what we call the joints in between, so it will not contact with bone to bone because it is so painful. That happens with osteoarthritis, wherein the joints are worn. So those are example of the joints. It allows movements of the bones, so gliding together. It also connects bones from bone to bone. Example are your knee joint, your metatarsal joints, the tarsal joints, the carpal joints, and everything. So even your vertebrum had joints in between. So because it has synovial fluid, so that nourishes, that protects, that cushions your joints in between. The synovial fluid also are loosened up or tearing up with osteoarthritis. Could also be inflamed with your rheumatoid arthritis or gout. It also protects the bones because of the synovial fluid, and as well as the joint cavity itself. So it's like a cushion. Okay, it also holds other ligaments. So most of the time, especially with big joints of our body, there are what I call to that ligaments that holds there. So it will limit the movement or the too much movement of your bone. So that's the function of your ligaments. So example of that are your knee joint, hip joint, your ankle, your ankle joint. So those are the example. Another function is maintain correct position. So that's why every joint, if there are too much movement, it will dislocate and the posture is kind of different, like weird position of your, if it's too much, like if they are hyperextended or something. So that's the function of your joints. Now, types of muscles are 3, which include your cardiac, skeletal, and smooth. The difference of the 3. Now, cardiac, of course, we all know that that's a heart. It's a involuntary type of muscle. We cannot control it. It's automatic. So it's involuntary. It contracts 24 hours, 365 days, every minute, every second of the day. So that's the heart or the cardiac muscle. Now, skeletal is the opposite, which is which could be found on the bone, because a muscle should have mostly that they have like the origin and insertion of the muscle. So skeletal is voluntary. We can control that. For instance, if you want to bend your elbow or extend it, so, or you smash through. So that is example of the skeletal muscle. Now, the smooth muscle or another example are found on the GIT tract of our body. So it's also involuntary. We cannot control that. So that's why when you get hungry, your stomach is best example of smooth muscle, they contract. So that is example of smooth muscle. So these are the three types of your muscles. Next, what are the functions of your skeletal muscle? Of course, these are for mobility or movement. You move, you walk, you smash the face of your enemy, so that is for mobility or movement. When you want to see something else, okay. Mobility and locomotion, it maintains a posture, and gait is like you're walking. Posture. Okay, so that's why the muscle contracts continuously. It allows us to stand and have a good posture. Strength, of course, you can see those bodybuilders. They use that, they recruit muscles, so that's why they're able to have those bulky muscle fibers. The more muscle fibers and the more strength it is, or the more force that you could provide. Okay, physical appearance. Of course, when you're muscular, and then you are less fat, so that's more attractive for some. But for medical purposes, for nursing, we have to consider some of the important muscle that we could inject for vaccination, like the measles or deltoid. We also had the gluteus maximus for other medication, because they are big bulky muscle, but nowadays they don't use that because there is a tendency that might hit the sciatic nerve, one of the biggest nerve that supplies the lower leg. And also we could choose this portion, the quadriceps muscle, which is the vastus lateralis and vastus medialis for babies for DPT vaccination as well. So we could use this as a reference. And also we should remember this one, the muscles on the neck, the SCM or the sternocleidomastoid muscle, which is affected for those babies who have the torticollis, or what we call the tight necked, or forgot that term, but it's torticollis. Check on that, okay? So that's for the skeletal muscle. That's all. It's very brief, so I hope you were refreshed a little bit with that. So thank you for watching, and God bless you.